This is Dr. Christy Webb. I'm a psychologist in Chapel Hill, North Carolina. People who have watched some of my videos often get in touch with me to ask further questions. Sometimes they want to start therapy with me. Sometimes they want to know how to find a DBT therapist. Sometimes they want advice about a family member or an intimate partner. My hope with this video is to give answers to some of these questions. First of all, I want to say that I'm always immensely flattered whenever anyone wants to start therapy with me. It's a huge honor that someone would trust me enough to want to share his or her story with me and to rely on my expertise and guidance. That said, I can't do therapy using Skype or FaceTime. Now, this is an issue with my license. It's only valid in North Carolina, and it's not good in any other state or country. If you're in the Triangle area of North Carolina, though, I'd welcome a call if you want to start therapy with me or with someone whom I can recommend. Now, it's also not ethical for me to diagnose anyone that I haven't met face-to-face and spent some time with. It's certainly true that I can usually get a pretty good idea about what's going on with somebody from a description of behavior, but any reputable psychologist will tell you that we can all behave in out-of-character ways under the right conditions. So I ask that people not try to get me to diagnose them or their family or friends over the internet. Now, I have to tell you that I get this a lot from my own family and friends, so please don't be offended when I tell you the same thing that I tell them. No. Okay, so how do you go about finding a therapist? I generally suggest starting with your state's psychology association. They have a referral service, and they'll generally give you 3 names and numbers. If you have health insurance, you can also go to your health insurance company's website, and there's generally a place to put in your zip code. They'll provide you with a list of providers who are in your area. The caveat here is that they'll only tell you about providers who are in network with that insurance company. So what that won't get you is anybody who's a provider like me who's out of network with all insurance companies. That's why I generally suggest starting with the State Psychology Association. And by the way, the state chapter of the National Association of Social Workers and the state chapter of the National Association for Licensed Professional Counselors, they'll give you the same kind of thing. So there you are, you have some names and numbers, and the next thing to do is to call them up and ask for an appointment. Tell them that you're interviewing therapists and that you want to find someone who's a good fit, because someone can be the best therapist on the planet and still not be right for you. We get these kinds of calls all the time, and my recommendation is that you do this face-to-face. Don't try to do it over the telephone. You should expect to be charged for it. And I also want to give a word about email at this point. Generally, lots of therapists won't use email with patients. The reason for this is that we're trying to protect the confidentiality of your information. If somebody steals my telephone that has patient names and numbers on it, I can always remotely wipe it clean. That's not true if my computer is hacked. Now there's a whole lot of confidential patient information out there in the ether for anybody to come across. And so because I'm very concerned about protecting your anonymity and confidentiality, I don't email with my patients. So pick up the phone, make the call, and set up an appointment to see if you can find yourself a therapist. Now, very often I'm asked how to find a good DBT therapist. Anyone who's watched any of my videos knows that I'm a DBT therapist and that DBT, dialectical behavior therapy, is the gold standard of treatment for borderline personality disorder. So here's what I recommend. Go to the website www.behavioraltech.org and click on DBT resources, then find a therapist. Anyone on that list is guaranteed to have been intensively trained in DBT, dialectical behavior therapy, and to be adherent to the entire DBT protocol. Now, if you're the family member or a loved one of someone with borderline personality disorder, it is helpful to have a DBT therapist for yourself as well. The thing here is that even if you don't engage in DBT, having a DBT therapist means that your therapist won't be frightened by or critical of the behaviors of the person whom you're describing. So you want to work with a therapist who has compassion for the other person as well as the ability to validate the struggles that you're experiencing. What if you can't afford can't get to, don't want, or already have a therapist and you want something a little bit more. Well, here's where I might direct you to my website, and that's www.drchristywebb.com. If you go to the resources page, I have there links to numerous websites on lots of different topics. They might include, of course, borderline personality disorder and dialectical behavior therapy, but also substance abuse, depression, anxiety, bipolar disorder, and some others. I also have an extensive book list. So if you scroll down to the bottom of the resources page, there's a link there that you can click on. It will open it up. There I give a title and, of course, a thumbnail sketch, a little description of numerous books on topics from dialectical behavior therapy, borderline personality disorder, to cutting, anxiety, mindfulness, and some self-help resources. So once again, that website is www.drchristywebb.com. If you're on Facebook, there's some good resources there too. I like the page DBT Thought for the Day. I also like American Psychological Association and John Kabat-Zinn, who posts about mindfulness. Every Monday morning I post the skill of the week, and you're welcome to like my Facebook page, which is Dr. Christy Webb. So, if you're feeling tempted after watching one or more of my videos to message me with a request for some advice, please know that much as I would like to be helpful, I cannot give you specific advice. The best thing that I can do is to point you in the direction of further resources. I'd love to hear how things are going after you've checked some of them out, and I thank you for watching.